Just because something looks like a duck and quacks like a duck and walks like a duck doesn't make it a duck. But at the same time, it's a bird we probably want to know a little bit more about. Well, hello and welcome to another episode of You and Me and Multiple Sclerosis. My name is Pam and I've been living with multiple sclerosis for almost 40 years. Recently, one of my subscribers asked if perhaps I might do a video on transverse myelitis. It's a term I've heard many times and I didn't know an awful lot about it. So I thought, yeah, I would like to look into that a little bit more. I'm going to present today some of the things that I found. One thing I'll tell you right off the bat is that I had a difficult time finding things that were recent. There's quite a few videos on transverse myelitis from 5 years ago, 7 years ago, 13 years ago. Same with the publications. There are some publications about transverse myelitis, but not as many as I would have thought. And certainly when you compare that to the publications and information available on multiple sclerosis. And the two diseases do have some linkages, some things in common. So why don't we take a look at what I found, and that will give us some idea of what this is and how it relates to multiple sclerosis.
Transverse myelitis. Transverse myelitis. So if you look at the word as I wrote it out, itis means inflammation, myelo means spinal cord. Transverse means it's going to affect both sides of the cord. It doesn't have to be equal, but it affects both sides. And so transverse myelitis is common in multiple sclerosis and several other central nervous system inflammatory conditions. We can see it with idiopathic transverse myelitis. You can have transverse myelitis from lupus. You can have transverse myelitis from multiple different infections. You can have transverse myelitis because of neuromyelitis optica, and we certainly see it very frequently in the setting of MS. People with primary progressive MS are more likely to experience a transverse myelitis or spinal cord involvement. Certain ethnicities tend to have more transverse myelitis, like African Americans tend to have an increased frequency of transverse myelitis. And transverse myelitis causes swelling in the superhighway, the highway that takes all the information from the brain, the supercomputer, down to your body and then back up. And when you have inflammation of the spinal cord in transverse myelitis, you have swelling of the spinal cord. And if the swelling occurs in the pathway for hand function, for motor function, your hand's not going to work very well. And if the pathway involves sensation, the sensations get goofed up. And so again, we'll use the idea that the spinal cord is like a giant highway and you have messages being sent back and forth, kind of like cars traveling up and down the highway. And if you have an inflammation, it's kind of creating a traffic jam. So the information can't go forward. And the information that's propagated gets goofed up. So sometimes with a transverse myelitis, you'll have paresthesias. Remember, paresthesia is numbness and tingling. And sometimes you have dysesthesias. Remember, that's painful sensations. And you can have a burning, a aching, a crushing, an icy cold sensation associated with a transverse myelitis. And if the transverse myelitis occurs at the level, let's just say here, then you can see those symptoms below the level of the transverse myelitis. And you may find that it affects one limb more than the other, one leg more than the other, but you'll still see changes in sensation, and you most certainly can see pain with transverse myelitis. It's actually extremely common.
This is a sagittal image of an MRI scan looking through the cervical spine like this. Here you can see the brainstem, the bones or vertebrae of the spine, the discs in between. Here is the spinal cord, and this white area represents a lesion consistent with transverse myelitis in the back or posterior of the spinal cord at the C2 level. We'll look briefly at the anatomy of the spinal cord so we can understand the symptoms of transverse myelitis. This is a cross-section of the spine something like this. And note that this is reversed of how it appears on MRI scans. So this is the back of the spine, and this is the front of the spine. Sensation comes from the dorsal columns, fine touch and vibration sensation, and the spinal thalamic tracts involved in sharpness and temperature sensation. The lateral aspect of the spinal cord, the right and left, contains the cortical spinal tracts, or the descending motor fibers, so injury to this area causes weakness, along with the frontal horn. The center of the spinal cord contains nerve fibers involved in urination control. We can also see in this longitudinal section that there are a lot of sympathetic nuclei in the mid-thoracic spinal cord and below, so injuries higher up can cause autonomic or unconscious nervous system symptoms such as changes in heart rate, goosebumps, sweating, and other unusual symptoms with severe injuries. Symptoms of transverse myelitis usually develop subacutely over days to a few weeks, as opposed to other disorders such as metabolic disorders or spinal cord tumors, where symptoms are usually very chronic over months to years, or trauma or strokes of the spinal cord, which are usually very acute over minutes to hours. The common symptoms are weakness of the limbs, numbness of the limbs or trunk below the level of the lesion. Bladder symptoms are very common, such as having to go often, urinary frequency, or straining to urinate, urinary hesitancy. Sexual problems, such as erectile dysfunction, are common, along with autonomic symptoms that I mentioned earlier, though they're often unrecognized. Sometimes transverse myelitis is classified based on the severity of the symptoms or the appearance on MRI scans. For example, if the symptoms are mild, such as only sensory symptoms, it's sometimes called partial transverse myelitis. If there are severe deficits below the level of the lesion, such as paraplegia, it's referred to as complete transverse myelitis. Usually with diseases such as multiple sclerosis, the lesions are very short, only 1 or 2 vertebral segments. If they're longer, 3 vertebral segments or more, it's referred to as longitudinally extensive transverse myelitis, as in diseases such as neuromyelitis optica. Sometimes the white matter is spared, and it primarily involves the center of the spinal cord or the anterior or front of the spinal cord where the motor neurons are, and that's often called gray matter-centric transverse myelitis, as in conditions such as polio and acute flaccid myelitis. There are many different causes of transverse myelitis. Sometimes it can be a uniphasic or one-time event and never occur again, and sometimes it can be part of a chronic autoimmune disease. Some examples of one-time events are when it happens after a vaccine or after an infection. The idea here is your immune system sees a foreign antigen, like from a vaccine or from a virus, and something about the proteinaceous structure of that antigen resembles part of your immune system, and it triggers an autoimmune result. This is kind of a fluke idiosyncratic event, and it usually would occur about 10 days to 2 months after the inciting event, and it usually does not recur even with future infections and future vaccinations. Sometimes it can be idiosyncratic, meaning we just don't know the cause, it just happens, and sometimes it can be part of a chronic disease, the most common by far being multiple sclerosis, but it's also associated with other autoimmune diseases of the nervous system, such as neuromyelitis optica or myelin oligodendrocyte glycoprotein associated disease, or MOGAD, or sometimes it can be associated with another systemic autoimmune disease, such as Sjogren's syndrome, lupus, or Behçet's disease. There's a disease called ADEM, or acute disseminated encephalomyelitis, where you get inflammation of the brain and spine spontaneously, more common in children, and sometimes transverse myelitis can be caused by an infection. Usually when it's caused by an infection, the symptoms are a little bit more rapid onset and severe, and some common causes include cytomegalovirus, varicella zoster virus, HIV, which actually causes a vacuolar myelopathy where you usually don't see a lesion, just atrophy of the spine, Lyme disease, herpes, or bacteria such as Listeria. Now, there's a lot of variation in the severity of transverse myelitis. Sometimes it can cause symptoms such as numbness in the legs for a few days and resolve spontaneously. Often an autoimmune transverse myelitis, for example, can be very mild. Sometimes it can cause no symptoms. A lot of people with multiple sclerosis have lesions of the spine, but no symptoms corresponding to that spine lesion. And sometimes transverse myelitis can be very severe and cause permanent neurological deficits. It just varies a lot. Sometimes the cause of transverse myelitis is very obvious, such as in multiple sclerosis, where the MRI of the brain shows clear lesions typical of that disease. But a lot of the times it's less often, so we need to pay close attention to the pacing of the symptoms and other symptoms in the body that could clue us in as to the diagnosis, such as ulcers in Behçet's disease or symptoms of other autoimmune disease such as lupus or Sjogren's syndrome. Often we have to do a spinal tap to try to figure out the cause, and these are the typical findings in immune-mediated transverse myelitis. In other words, in diseases such as multiple sclerosis or post-infectious or post-vaccination transverse myelitis. Generally, there's an elevation of lymphocytes, a subclass of white blood cells. Normally, there are less than 5 per microliter. In this study, in immune-mediated transverse myelitis, there was an average of 38 per microliter. In diseases such as multiple sclerosis, it's usually a little bit lower, such as 5 to 15. Generally, the protein is elevated. Normal is 15 to 45 per deciliter. In this study, the average was 75. Usually, the glucose or sugar is normal, and culture for routine infections like bacteria is generally normal. There's specialized tests in the spinal fluid to look for causes such as herpes, CMV, or varicella. Next, we'll move to treatment of immune-mediated transverse myelitis. So the typical treatment is steroids to suppress the immune system and calm down the inflammation in the spinal cord, and the most common drug used is intravenous solumedrol or methylprednisolone. A very high dose of 1 gram or 1,000 milligrams is used daily for 3 to 5 days. An alternative is to give the same drug orally, and sometimes we can't get large tablets of methylprednisolone, so instead we'll use prednisone, 1,250 milligrams orally daily for 3 to 5 days. This is 25 50 milligram tablets, and it turns out that it's probably equally effective if taken properly. Now, high-dose steroids can damage the stomach and sometimes cause ulcers, so we'll often give protection to the stomach in the form of an acid blocker, such as Pepcid or Protonix, and sometimes we'll give a slow taper of steroids afterwards just to continue the treatment for a little bit longer and come off of steroids slowly. Now, for people who don't recover after steroids, there are other treatments. One alternative is plasmapheresis or plasma exchange. This is a dialysis-like procedure that removes abnormal antibodies and other immune factors, hopefully reducing inflammation of the spinal cord. Typically, we do 5 treatments, often every other day, just to give the body a break. For some people with very severe transverse myelitis where these treatments aren't working, we'll use other stronger chemotherapy drugs. One regimen I've had some success with is cyclophosphamide or Cytoxan, 1 gram per meter squared, monthly for 6 months. For instance, I have a patient who had neuromyelitis optica with very severe cervical spine myelitis who was quadriplegic and dependent on a ventilator, but eventually recovered and was able to walk, though she did have some residual neurological problems. So there is hope even for people with very severe transverse myelitis.
I found this article. It's quite recent. It's from the National Institutes of Health, the National Institute of Neurological Disorders and Stroke, on transverse myelitis. And just to see what's on the page, what is transverse myelitis? Who is more likely to get transverse myelitis? How is transverse myelitis diagnosed and treated? What are the latest updates on transverse myelitis? How can I or my loved ones help improve care for people with transverse myelitis? And where can I find more information about it? And I'm not going to look at all of these because we've already covered some of this information, but I will link this article so you can look it up for yourself because there's good information here. But let's focus on this section right here. What are the latest updates on transverse myelitis? And as they say, they are the leading funder of research on neurological disorders. NINDS, the National Institute of Allergy and Infectious Diseases, and several other components of NIH conduct research on transverse myelitis and fund research at major institutions and universities. Their funding supports researchers who work to understand how the immune system destroys or attacks myelin in autoimmune disorders. Other research focuses on strategies to repair myelin in the spinal cord, including approaches that use cell transplantation. This research may lead to a greater understanding of how myelin gets damaged and may ultimately provide a means to prevent and improve treatments for transverse myelitis, and I would say probably multiple sclerosis as well. And the first thing they talk about is glial cell studies. And they say that glia or neuroglia are non-neuronal cells, cells that do not generate electrical impulses in the nervous system that form myelin and provide support and protection for neurons. Oligodendrocyte progenitor cells, or OPCs, are stem cells that generate oligodendrocytes, a type of glial cell that produces myelin. And you'll remember we've talked about these quite a lot in relation to multiple sclerosis. So the same thing is going on here. NINDS-funded scientists are studying mechanisms in cells that control how OPCs form and mature and possible ways to increase oligodendrocyte proliferation and remyelination after spinal cord injury, which is one of the ways that you can acquire transverse myelitis. Astrocytes, another type of glial cell, may activate parts of the immune system in neuromyelitis optica spectrum disorder, which is another closely related condition to multiple sclerosis, a disorder that causes transverse myelitis. Many researchers are trying to understand how astrocytes affect autoimmune diseases, and we've looked at some of that research recently in respect to multiple sclerosis. They also talk about genetic studies. NINDS-funded scientists are studying a very rare genetic change that has been linked to the disorder to understand whether there may be a genetic component of idiopathic transverse myelitis. And remember, idiopathic just means we don't really know what causes it. Regenerating nerve cells is another area of study. Some researchers use animal models of spinal cord injury to learn ways to replace or regenerate spinal cord nerve cells. The goals of these studies are to find ways to restore function in people who have paralysis, and that is a really important one. I am not sure if they're going to focus on injury caused, parasitic caused, infection caused, inflammation caused. I don't know what their goals really are, but this is a very important piece of research that will have implications not just for transverse myelitis, but also for multiple sclerosis. Neuroimaging with MRI. Research funded by NINDS aims to develop and use new MRI techniques to study the relationship between problems in the spinal cord and neurological dysfunction in MS. This approach may assess changes in lesions and myelin in MS and possibly transverse myelitis. Other researchers are developing MRI approaches that can identify the extent of injury to the spinal cord and monitor recovery after injury. These techniques may allow earlier detection of transverse myelitis and other neurological disorders such as MS. And then finally, brain-machine interfaces and prosthetic devices. Scientists are developing brain-machine interfaces and neural prostheses to help people with spinal cord damage regain functions by bypassing the injured area. While this research is at an early stage, these sophisticated electrical and mechanical devices can connect with the nervous system to supplement or replace lost motor and sensory function. And they'll say that more information on this kind of research is available through the NIH Reporter, a researchable database of current and previously funded research, as well as research results and publications. And another thing that they recommend in one of the following sections is that people can enroll in a clinical trial to help advance the state of research in this area. And so I thought I would go look at what is available through clinicaltrials.gov at the present time. And again, this is another site from the National Library of Medicine. And I just searched transverse myelitis. I was not limiting it to recruiting or already published or whatever. I just wanted to see everything that was available in every country at all times. And as you can see, there's quite a bit that's been looked at over the years. I thought I'd just focus on this one because it is actively recruiting out of Dallas, Texas, the United States. It's called Study to Investigate the Safety of the Transplantation of Human Glial Restricted Progenitor Cells into Subjects with Transverse Myelitis. And this, of course, would have implications for multiple sclerosis as well. I know that there are studies that are looking at these glial cells and the oligodendrocyte progenitor cells, so that we can begin to look at ways of reversing and perhaps even curing multiple sclerosis and transverse myelitis. So I will link to this study particularly, but also to the page that just lists all the studies that have gone on, are going on, have been terminated for whatever reason. When you see terminated, by the way, it could be something as simple as they did not get enough people recruited in order to meet the goals. If you don't get enough subjects, your results are not going to have any statistical validity. So that is one reason why being recruited for these studies and enrolling in some of the ones that look like they might be promising for the condition that you're dealing with, very important, because that's a way that we can help, we can participate in moving research forward and hopefully getting to a cure eventually. Well, okay, so I guess what I'm getting out of this is that transverse myelitis is not multiple sclerosis. It's hugely different in one big sense, and that is it doesn't involve the brain, it involves the spinal cord. At the same time, though, transverse myelitis could, in some cases, become multiple sclerosis. I would think that nowadays, with the MRI being so commonly used, there's not going to be very many times when you think you have multiple sclerosis and in fact you don't, you have transverse myelitis. The opposite might actually end up being true more often, because you might start as transverse myelitis and turn into multiple sclerosis later on. But be that as it may, it's good to know that there are different mechanisms that seem to be causing it sometimes. Immune-mediated transverse myelitis is probably the thing that would most closely resemble multiple sclerosis, because once again, it's hard to know when and how it started and whether some lifestyle factor contributed to it. We kind of don't know. Sometimes transverse myelitis is caused by something that's readily discernible, and that's the kind of transverse myelitis that can be treated and even cured. But some of it, like MS, is something that you just learn to live with. And as you can see, there's levels of severity, just like with MS. Levels of severity and the course in the future may not always be very certain. So yeah, good to know this, and I appreciated the chance to get to look into something I didn't already know a lot about. That's kind of what this channel is all about, is learning, right? And you're not the only ones doing the learning here. I learn right along with you. But that's all I have for you today. So until my next video, take really good care of yourself, and I'll see you again.